So we're gonna extract a couple tubes of blood from Tim here. After that, the PRP is platelet-rich plasma. So we're gonna separate that from the red blood cells with a centrifuge. Just gonna spin the blood for about 10 minutes. And then after that, I'll process the PRP so we can inject it and hopefully help Tim meet his goals here. Okay, not too bad, right?
No.
Okay.
Today we're going to be doing platelet-rich plasma treatment to our patient's scalp. We're doing this treatment because our patient has two conditions. Number one, hair thinning and male pattern baldness. Our patient has noticed he's losing hair in the crown and he's thinning in the front and the sides. He's also seeing temporal recession. When we do platelet-rich plasma, there's three ways to do it. The first way we offer it, which is our best way, is using donated human placental exosomes, or basically the growth factors that are made, that are harvested, and then we mix that with the patient's plasma for the injection. The second way we can do it is we take the plasma. Now the way we get the plasma is, you've seen it, we remove tubes of blood. That blood goes through a centrifugation and separation system, and once we harvest that liquid, in that liquid we can either put those exosomes I talked to you about, or we can put donated pig bladder cells. That's another option we can do. The third way is we can just inject the plain plasma. Now, in my opinion, using the growth factors, either exosomes or the pig cells, helps get the most growth. Our goal today is going to be to help stabilize the patient's hair loss, give them more growth. We'll be injecting in the frontal scalp and the crown. Now, these treatments that we do, they're not FDA approved. These treatments can help, they may help, but there's no guarantee. We're going to do it cautiously. We'll do our best. We do the treatment, then see what happens. Let's do it.
Okay, so our blood has just been done spinning. So everything looks good. Okay, yeah, so these separated nicely. We're gonna draw this up. So we're gonna separate the PRP from this red blood cells that are underneath. So in between, we do have a little bit of a buffy coat, so we're gonna avoid the gel that forms here as well, so that we just draw up the platelet-rich plasma. So we've just drawn up all of our PRP, so this is a nice little amount here. We're gonna transfer this into some smaller syringes first, and then we'll get Tim ready to start injecting.
We have the plasma prepared in the syringes. We use special 1cc syringes for our injection. When we start the injection, we focus on what's important for the patient, making sure we pay attention to the areas that are most thin, but distributing the product in nice, even fashion. We're injecting right below the epidermis. We want to inject in the dermis where the hair follicle is in. Sometimes people can do this too deep. It doesn't work and causes more problems. We are using a special chiller for the injection. This helps decrease the pain and the bleeding. And I also feel helps shrink the blood vessels so people can get less bruising. Once we've done the hairline, you can see there's very minimal bleeding. Now we're looking back at the crown. You can see he has a significant amount of thinning and loss here. So we're going to inject the whole crown in the dermal layer, evenly distributing it to the area that's thinning, and we're working around the periphery too. You can't just focus on one area. You have to focus on the entire region. The needle is going into the dermis and the injection is done. You can see there's minimal bleeding, very little pain with the chiller.